Welcome to the latest edition of our AT Kearney Procurement and Analytics Solutions, the Wave of the Future podcast series. I'm Helen Clerk, and I'm joined today by Rodey and Ella Berlyand, a principal and a manager at AT Kearney in our health practice based in Toronto, Canada. The topic of today's podcast is the future of healthcare in Canada. Many countries are experiencing increased costs in healthcare, and at the same time, life expectancy is increasing, which makes for a difficult situation. I'm therefore keen to hear Rodey and Ella speak about the situation of the healthcare industry in Canada and what the future looks like. Rodey, welcome to the podcast. Let's start with the current state of Canada's healthcare system today compared to other OECD healthcare systems. Can you describe how healthcare works in Canada compared to, say, the UK or the United States?
That's a great place to start, Helen, because the Canadian healthcare system is a bit unique when comparing to other OECD countries. While most countries' healthcare systems are both public and private, the Canadian system is fundamentally a public one. Healthcare in the traditional sense, doctors and hospitals, is 100% public, with private care being illegal in this space. This stems from a principle of universality of care, a point of pride for many Canadians. That isn't to say the private sector doesn't play a role. It most certainly does, especially in areas like prescription drugs, dental, and vision. All healthcare systems are facing challenges of funding care. Healthcare costs have been growing significantly, outpacing GDP growth in most countries by 3 to 4 times. And to better understand the long-term implications of this cost growth imbalance, we did a study working with the Conference Board of Canada to understand the future realities of the Canadian healthcare system and potential solutions and innovations to ensure that system is there for Canadians in the future. We knew there would be sustainability issues, but we were a bit surprised at how significant the financial gap was. And the reality is this isn't a Canadian-only problem. All healthcare systems are struggling with this issue. You can see it in some of the news headlines, Helen, especially just recently in the UK, where there was a doctor strike, being a clear example of some of the fiscal imbalances that are trying to be managed in healthcare systems today. As we started this work, we began comparing Canada's healthcare performance to other OECD countries today. And while Canada is in the top half of OECD healthcare spending, when we look at healthcare outcomes, it's actually near the bottom. And the reality is Canada's healthcare spending has not yet delivered the better access or quality of care as compared to other countries. Looking at the UK, you actually have a much higher performance in terms of healthcare outcomes for a lower overall healthcare cost. On the other spectrum would be the US, which spends significantly more than Canada or the UK, but has worse performance than both those countries. And to me, this suggests the answer doesn't necessarily lie with just more money, but it's really about doing some things fundamentally different in how the system works, how we manage costs, how we proactively go after disease prevention and leverage technologies. So that was really the bulk of what we wanted to study and really understand as we look to the future of healthcare in Canada.
Excellent. Thanks, Rodey. So, Ella, the research that you did for the Conference Board of Canada mentions a number of healthcare trends, such as life expectancy and costs. So, how will these trends affect the future of Canada?
Helen, that's a really good question. The growing life expectancy is a great thing. Canadians are living longer, healthy lives. However, that naturally means there are many more years where the system needs to support our aging population, and there are less working-age people compared to retirees. In addition, we're seeing a greater share of chronic illnesses on which patients are living longer. Canada, like many of its OECD peers, is experiencing a demographic shift, whereby the country's largest cohort of baby boomers is starting to move into retirement. This shift represents expected increases in demand for different health services and drugs, ultimately representing expected increases in healthcare spending. Population aging has resulted in an increase in the average length of stay and medical resources needed by patients over the last 10 years, and the demographic shift is expected to add about 1% to the compounded annual growth rate for healthcare spending over the next 20 years. Inflation in the healthcare sector has outpaced that of the general inflation rate, driven primarily by the widening gap between healthcare and non-healthcare wages. These increases include fee schedules, physician compensation, and general hospital costs, of which physician compensation is a large share, about 50%. This has grown much faster than provincial revenue streams. So our current provincial revenue growth is clearly not enough to sustain the healthcare spending growth, creating the sustainability gap, even with most favorable demographic and cost growth conditions being modeled, such as increasing immigration and being very conservative with pay increases. So there's several opportunities areas that we'll talk about a little bit more, but clearly a sustainability gap is being created.
Rodey, tell me about the main gaps in Canada's current healthcare system that is making it so unsustainable. Are other countries experiencing the same issues?
So the answer is yes, absolutely. Most countries are experiencing the same issues. And the reason is the gaps that we're seeing arise out of a mismatch of what our healthcare systems were designed to do versus what we truly needed to do today. So Canada's healthcare system, like many in the developed world, were developed to be truly an acute care system. So dealing with one-off issues that people had. But given the trends Ella just mentioned, Canadians and others in the developed world need a system that is much more better equipped to manage chronic care. So that disconnect is where we see the gaps in care arising, which drive costs and also drive poor healthcare outcomes. So how do these gaps show up in people's lives? Because in an acute care system, care coordination is not key. We often lag in enabling that. And care coordination is vital to treating chronic conditions. A classic example is a patient discharged from the hospital. Often when patients are discharged from the hospital, they have a new regimen of medications. And it's different from what they had prior to entering the hospital. How do those changes flow to the patient's family doctor or the pharmacist? How does the patient reconcile her new medications versus those that are already in the medicine cabinet? So you can clearly see how those gaps start to arise by not having better care coordination. The heart of chronic care and achieving great patient outcomes is all about changing behavior. Currently, our care doesn't focus or drive sufficiently behavioral changes. The reality is changing someone's behavior requires time, and time isn't something that most practitioners have in great supply. So this need also goes unmet. And these kinds of disconnect is exactly what's driving the sustainability gap in Canada and in many countries. Without significant changes to the Canadian healthcare system, we actually forecast that sustainability gap will outpace the ability for government to pay by $200 to $300 billion in 2035.
So, Ella, I want to talk about the role of technology and the role it can play in decreasing costs and making healthcare much more accessible. So from your perspective and the work that you've done, how can technology play a role in developing a more sustainable healthcare system?
Well, there's no silver bullet to managing healthcare costs, but technology can be seen as a really big enabler for improving quality of care at affordable prices. The first step is adopting and effectively deploying existing key technologies such as integrated electronic medical records. While these are being deployed to varying degrees, the lack of integration across different systems created a very big limitation in our ability to really impact care outcomes and costs. Learning from Canada's past and learning from the UK as well, we should start small with a scalable approach and being very focused on improving the system for providers and for patients. Beyond that, more advanced examples include tracking patient health via remote patient monitoring, adopting consumer technologies to engage patients, and activating patients to actually manage their own care. From a remote care perspective, one notable of many examples is teleconsultation, which uses video conferencing to link Canadian patients with their healthcare teams remotely when they're not in the same physical location. Using these technologies increases access to care and reduces wait and travel times for the patient. It also directs the patient to the right service at a better cost to the system. While telecommunications are growing in Canada, the penetration and availability of channels still lags far behind other countries. Some other examples I wanted to share with you include adopting consumer technologies to support patient activation. As we're seeing proliferations of wearable technologies and mobile technologies, there's already a trend towards empowering patients and consumers to have better access to information and incentivizing and monitoring them. Also creating communities of care and support networks with folks with different types of ailments, where individuals with similar ailments can actually connect, share some of their challenges, share tips, share tricks. So, for example, people that have higher level of cholesterol may share healthy lifestyles and healthy recipes between them to get better access to information and creating social incentives and greater motivation. A third and important option is activation patients to really actively manage their own healthcare and navigating the system better. Let's take ER visits, for example. Equipping patients to better navigate the system, know when to visit an ER versus their family doctor. The Alberta government runs a patient portal called My Health, which is a personal health record platform. The portal provides a symptom checker to help patients decide whether to go to the emergency room or see their own family doctor. Patients can also use provincial wait times that are available on the website to make certain decisions, and they see wait times for ERs, for surgery, and as well as for specific tests and scans. The platform actually complements the system and suggests healthcare providers to the patient based on their indication of the type of facility, service, or healthcare needed. Last example is similar to a common app for restaurants called Yelp. It's The League. It comes from the US and it was recently launched in Toronto. It's an online tool that allows users to see a curated list of health and wellness providers, looking at different preferences like, do you want to learn how to eat better? Do you want to lose weight? Do you want to find some meditation and mindfulness retreats? And users can also contact the physicians based on the information provided there, getting pricing and booking directly through the platform. These examples are really powerful in terms of increasing access to information and services, getting convenient and educational platform for identifying the most appropriate provider, and getting providers connected with users while building credibility and goodwill based on past experience to have an overall improved quality of care and more competitive pressures and therefore affordable costs.
Ella, there are some really interesting examples there that you went through, getting patients to talk to each other, networking, patient empowerment, etc. What about best practice examples of healthcare systems from other countries? Do you have a couple of examples you can share with us?
Helen, let me share a couple of examples from the US and the UK. There are several important care delivery innovations that we can learn from. From the US, we can learn about linking incentives to patient outcomes and efficiency, given the private nature of their healthcare system. To create a healthcare system that truly drives innovation, Canada will need to reset its funding model by linking incentives to patient outcomes and efficiency. And several funding models tied to outcome measurements are already being leveraged across the world. In the US, capitated payments were implemented for a medical group in Southern California. Capitation funding models base payments on the number of enrolled patients instead of the number of times a patient visits a doctor, which reduces the incentive to provide unnecessary services and encourages lower repeat visits. This care group tied compensation to performance by evaluating physicians on quality, patient satisfaction, leadership, and efficiency. Thus, physicians were incentivized to improve their processes and delivery of care to better achieve outcomes and measure those regularly on a semi-annual basis. From the UK, we can learn about creating an environment of selective competition given the nature of that system. Competition in private industries often incentivize firms to increase their innovation and their productivity while remaining cost competitive. Similarly, competition in healthcare can encourage the development and uptake of different innovation, focus on process improvements, and push providers to be more effective in their care delivery. Due to the controversy and a lot of political sensitivity around introducing competition in public systems, and especially in the Canadian public healthcare system, Canada hasn't made big strides to encourage competition. We believe from our research that if managed correctly, selective competition could challenge the supplier power of providers and provider groups. This would provide Canadians with more choice and better value for every dollar spent on healthcare. So in the UK, for example, the UK healthcare reforms implemented in 2006 enabled competition by giving patients the option to select from 4 or 5 hospitals for his or her healthcare. Fixed price reimbursement would avoid any competition based on the price. The impact of these reforms allowed good hospitals to get more patients and get a greater allocation of their healthcare pounds. At the same time, quality of care rose without increases in overall expenditures. Initial studies measuring the effects of these changes also show that patients discharged from hospitals located in markets where competition was more feasible were less likely to die and had shorter length of stay in the hospital. Moreover, the impact of competition amongst hospitals reduced mortality rates by a third when compared to hospitals not pressured by a competitive market. Last length of stay in hospitals pre-surgery was shorter in competitive environments than among providers in a monopolistic system, creating better outcomes for the patients as a whole.
So, Rodey, if Canada were to adopt the reforms that you've proposed, what would be the financial implications for the country?
Always comes back to the dollars, and it's important. So the reforms that we've proposed would lead to about a cost reduction of $70 billion annually in 2035. While that's a significant amount, it doesn't solve the fiscal imbalance that I mentioned earlier. To truly get to a sustainable model, the government and the public will need to focus on health promotion, prevention, and social determinants of health. So those are all elements beyond just how our healthcare system functions. Those are key drivers that start well before you enter the healthcare system. And the reality is only through addressing all of these elements will we be able to get to a sustainable healthcare system that delivers the patient outcomes that Canadians deserve.
And Rodey, the last question to you in this podcast. In your view, how can the Canadian government foster a healthcare environment that really encourages innovation, efficiency, and improved quality? From your perspective, what changes need to take place?
It's a great question, and it's at the heart of the research that we were doing. The first piece we must undergo is enabling that care coordination. And you can do that through building an integrated EMR system that allows providers across the spectrum to really see patients completely and fully. Too often today, providers only have a small view of the patient. And by opening it up, that's going to allow for a better treatment overall for that patient and allow more effective care across providers. Second, we need to be constantly looking for opportunities to better use our health resources and our health practitioners. We need to start tearing down some of our old ways of thinking about who can do what. We need everyone operating at the top of their license, and in many cases, expanding scope through targeted programs. A good example of that is minor ailments at the pharmacy. It's a program that's been tried in a couple of jurisdictions in Canada quite successfully, as well as in countries around the world. And what that allows is for a pharmacist to treat minor ailments that may not require a physician to diagnose and treat. Third, we need to develop concrete strategies and tools to drive patient activation, such as expanding home care and shifting the focus of those home care workers from doing to teaching, investing in patient support networks, and allowing new entrants to help drive the chronic disease management space. Fourth, we need to replace our funding models with a new comprehensive funding structure tied to driving efficient outcomes. We need models that embrace innovation instead of standing in their way. We need to work on paying for outcomes instead of paying for actions. So that's the summary of our 4 recommendations that we think the Canadian government needs to pursue to really foster a healthcare environment that encourages innovation and ultimately drives to a more sustainable model. While it's easy to speak of these recommendations on this podcast and kind of in our paper, the reality is making those come to life will require significant stakeholder collaboration, will require significant changes in the way the healthcare system operates, as well as the way practitioners operate. So it's a significant undertaking, but it's a very necessary one for the Canadian healthcare system to be there in the future.
Thanks, Rodey. So to summarise, there are 5 key takeaways that stand out for me in terms of improving Canadian healthcare. And these are, number 1, the role of technology in healthcare. Number 2, competition between providers. Number 3, patient empowerment. Number 4, new funding models. And number 5, patient support networks. And on that note, I'd like to thank Rodey Wing and Ella Berlyand for being my guests today and sharing their views on the future of healthcare in Canada. I'd also like to thank our production engineer, Tom Klein. Thank you for listening to this edition of The Wave of the Future. If you have any comments on this podcast or have a suggestion for a podcast topic, please share your thoughts via Twitter. Our Twitter handle is @ATKPAS. This has been an A.T. Kearney Procurement and Analytic Solutions podcast production. Join us again soon for our next Wave of the Future podcast.